right here. What do I mean? So these are the anchoring points of our, right, our lymphatic capillary. So they anchor, and when they anchor, there's no movement in that area. So what happens? Now, let's say you get a cut on your lip, and it's always the lip. I remember when I used to wrestle, I would wear braces. Nothing says hit me in my mouth more than wearing braces when you wrestle. So every time I just get smashed, my lip would just become huge. You guys have all had that before when somebody accidentally elbows you or something, right? And then your lip swells up, and that swelling is edema. What happens when you have edema? When you have edema, you have a lot of fluid buildup right here in the surrounding tissue. As you have a lot of fluid buildup, there's more pressure now in this surrounding tissue because of all the water that's here, right? Since these points are all anchored, well, these overlaps, there's so much pressure, it causes the sides to pinch inwards. As the sides of these cells pinch inwards, more water leaks in. So the more water here, the more fluid here, the more fluid then pinches inwards these cells, allowing more fluid to go into your lymphatic capillaries. As you have a lot of fluid moving down, right, that fluid starts to expand the area when the fluid goes down. Why is this important? As it expands the area, it seals it. So then the fluid that you just brought in can't leak back out. That way we're kind of allowing that flow to occur in one direction. And that direction is away from your tissues towards the lymph nodes. Because whenever we get a cut, obviously we have our skin has bacterium in there. So we will always introduce some kind of microbe into our system when we get any kind of a cut. Even when we try to be as clean as possible, right? We do sterile techniques when we do, right, surgeries. Even putting on gloves. If you've ever seen people put on gloves for a surgery, there's like a dance to it. It's not just like I just put on gloves. That's not it, right? You have to kind of, you know, put your hand in a certain way, and if you mess up, you got to scrub back out and do it again. So there's an art form into actually keeping sterile. Now, we do all that, and then we do a lot of, you know, be it iodine, so then we can make sure that area we're cutting is very clean, and yet people still get infections. Why? It's not because of the scalpel, it's because it's your skin, right? When we're cutting through your skin, we're actually pushing a little bit of your epidermis into the dermis. So no matter how sharp the scalpel is, you're always going to push a little bit of your skin, your epidermis, into the dermis. By pushing that layer of the epidermis inwards, you're pushing a little bit of the bacterium on your skin into the dermis. And now you have a chance of getting an infection. So once we do, we want edema. As you have edema, what occurs? You're flushing all that fluid into the lymphatic system. As you flush all that fluid in, any viruses, any bacterium goes in with it. Perfect. That's what we want. Now we'll have a kind of go through the lymphatic system. We do have a model for it. It's very small, right? Just very few things on there. Sorry, trying to go through this. In terms of the lymphatic duct, the right lymphatic duct, obviously I've kind of highlighted this a few different places about where we see the drainage, right? Probably the easiest way to remember is everything on the left side and throughout the rest of your abdomen and torso is going to go through the thoracic duct. All fluid enters then into the left subclavian vein. Only the right upper body empties into the right lymphatic duct, into the right subclavian vein. Either ways, that fluid gets introduced into the subclavian veins after it has gone through a series of lymphatic nodes. Those lymph nodes allow us to filter that lymph fluid, so then there's no more bacterium in that fluid. Because the last thing we want to do is bring that fluid full of bacterium right into your subclavian, right into your bloodstream. That's sepsis. So we don't want that to happen. So we need to filter it. That's where these lymph nodes come in, right? The lymph nodes are going to trap the microbes, So then they're stuck in the lymphatic nodes. The fluid that exits a node, like we see here, the fluid that exits and goes into the subclavian vein will hopefully be free of any of the microbes. By the way, this is the reason why we can have such bad infections and still not get sepsis. Right? You hear people getting ulcers that are really bad, and yet they're not septic. Why? It's because our body does a great job localizing that infection by bringing that fluid in that area through a series of nodes that traps the bacteria. Then the fluid that drains into the veins will be free of the bacterium then. Now, in terms of movement, again, right? Lymph, the passage of lymph is from arteries and blood capillaries to the interstitial fluid, where 90% of the fluid that moves out is reabsorbed. 10% goes to the lymphatic capillaries and turns into lymph. Then the lymphatic capillaries drain to lymphatic vessels. Lymphatic vessels drain to the nodes. The nodes then drain into the thoracic duct on the left side of your body and your whole lower body, or your right lymphatic duct for the right side of your upper body. Once it goes into these, then we drain it into the subclavian veins, where we can reintroduce that fluid pretty easily. Now, lymph, and I highlight this and underline it, right? Lymph flows as a result of the milking action of the skeletal muscle contraction and respiratory movement. In other words, the same system of skeletal muscle pump and respiratory pump or thoracic pump allows us to bring that lymphatic fluid through the lymphatic vessels up into the thoracic duct into the left subclavian. From the lymphatic vessels into the right lymphatic duct into the right subclavian. And we'll talk later on about more with obstruction of lymph flow. We kind of talked about it with, elephantiasis. Right. Again, this kind of shows us the way that the fluid moves here. It goes from the capillaries. That fluid then goes into lymphatic capillaries, through a series of nodes, then return back into circulation. Right here. Now, in terms of these, I don't know if you guys remember looking at reticular connective tissue, but with reticular connective tissue, right, I know, that's a long time ago, right, we saw like clusters of circular aligning cells right here. We call that a nodule. And what we're going to see is there's a you're not imagining it, it's there. There's a circular arrangement of these millions and millions of different white blood cells. And what we're going to see is this, right? White blood cells, they all have receptors. And when we talk about specific white blood cells, they have specified receptors. And those receptors, well, they're going to recognize one thing, all right? One type of protein, and that's it, right? And in order to recognize it, it needs to be able to mature in this area so that it can learn what to recognize and what not to recognize, meaning it can make sure that it doesn't attack your body cells. Right, so tonsils, some of these we can see. Obviously the pharyngeal tonsils you're not going to see by opening your mouth, but you will see the palatine tonsils. If you ever watch videos on YouTube, every now and then you'll see, on YouTube, people with tonsil stones, which is gross. Those are basically infections there that solidify. You can imagine how bad that breath must smell, right? And those palatine tonsils right there, they become kind of embedded with bacteria, right? Nowadays, we don't remove those tonsils much, right? But it becomes really embedded and you get a lot of infections. Yeah, we can kind of take these out, the palatine tonsils. We usually remove the pharyngeal tonsils. They're in the back of our throat. They're also called the adenoids. But we don't remove them because of any infection. We usually remove the adenoids because of sleep apnea, right? When they become enlarged, it decreases the size of your opening for your nasal canal. So it becomes harder to breathe when you're asleep. right? The palatine and the pharyngeal. Yeah. Nowadays they try not to do it, but yeah, I can imagine that if it's bad enough, they will remove it. Again, with the nodes, superficial, they're near the skin. Some are deeper in the GI tract. Now, anybody's ever heard of I don't know, Yersinia pestis, bubonic plague, right? Bubonic plague, or plague in general, is going to seed in the lymph nodes, usually in the axilla, sometimes in the inguinal areas, right? As it seeds there, well, they have spores and they become very strong. And the actual spores of this bacterium, well, our white blood cells can't kill it. So it starts to infect the nodes, right? And what happens then? Then that area becomes very edematous, right? So we do find them near the skin, deep. They have reticular fibers forming the support structure. The lymph nodes are the only structures to filter lymph and the site of antigen presentation from macrophages to T and B cells. T and B cells are our very specific white blood cells. They recognize one common epitope, all right, or one three-dimensional shape of a protein. And sometimes that protein is found on a virus. Sometimes it's found on bacterium. And they are able to then activate when the bacterium is around. And we'll talk about it coming up later on because, right, this whole process is actually pretty intricate. Yeah, the T and B cells can't just go into your bloodstream and attach itself to a virus and kill that virus. It needs to be activated first. It needs to be presented, that part of a virus, so that it can become active. Right, lymph nodes through the afferent vessels. Then that lymph is filtered to remove damaged cells and microbes, and then they exit through efferent lymphatic vessels. So there's afferent and efferent vessels. And we're going to see that as well. Here, there's a picture of it. So you have the afferent bringing that lymphatic fluid in from your tissues. And they can be full of bacterium. Right? You have a lot of afferent, right, vessels. Very few efferent. Right? E for exit. All right? The efferent vessels, well, the fluid here should be clean, right? You've filtered out all the bacterium and microbes by bringing it through this series of tissue right here. Okay, so you guys have probably heard of people sometimes have their nodes felt, and then afterwards, especially in the movies, they think about, they feel it and they're like, oh, you better be careful, or you better get all this workup in because we might think you have a cancer. Now, important thing to remember is this. Cancers metastasize either by way of the bloodstream or by way of the lymphatic system. Breast cancers usually metastasize or move by way of the lymphatic system. That's why we always have check the nodes next to it, the axillary nodes. In the old days, like 30 years ago, 35 years ago, they would just kind of remove all the nodes in the axilla, right? Because remember, all that fluid in your breast area needs to go through the axillary nodes, then has to go into your subclavian, by the right lymphatic duct here. Well, if we remove all that fluid here, right, or you remove all those nodes in the axilla, how are you going to remove and drain all the fluid that goes in the arm? Remember, 10% of all the fluid is left for the lymphatic system. So what happens if you get rid of all the nodes in the armpit area, and now you can't reintroduce that fluid into the subclavian on that side? What happens is you are more likely to have edema in that area, really bad lymphedema. Now, usually with the lymphatic system, when we see a node that is firm, very large, and there's a big one, non-tender, right? So it's big, it's large, and now it's not tender. That's when we're worried about cancer. Why? Well, when you have a cancerous cell, a tumor that spreads, is going to go into the lymphatic system, go into the lymph nodes, and now it's going to start to divide in the lymph nodes. And you're going to have more cells in the lymph nodes. And those cells now enlarge the lymph node because there's so many cells inside of it. As they enlarge the lymph node, well, there's no inflammation, there's no kind of attack. So there's no tenderness. They become large and non-tender. Now, we should see that tenderness when we are having an infection. When you have an infection, you have microbes going into the lymph node. Your white blood cells go there and starts attacking the bacterium. As it attacks it, it releases very strong enzymes, causes massive inflammation, which causes pain. So we should see a little bit of tenderness. Now, it shouldn't hurt to touch, but this should be tender when we palpate the lymph nodes. Secondary tumor sites can be predicted by direction of lymphatic flow from the primary site. And then what we're going to see is that there's a reason why we think, when we think you have metastatic breast cancer, the second place we look is in the lungs. Why the lungs? Simple, right? You're bringing that, if you have metastatic cancer from the breast, you're bringing that tumor cell to your subclavian vein. Then you're going to bring it to your brachiocephalic vein, into the superior vena cava, out the right ventricle. Where's the next space? Next area, right? The pulmonary trunk, and then your lungs, right? So the next big area is going to hit is your lungs. And that's why we always do a chest x-ray as a result. Now, it's talking about cancers as well, right? In terms of some cancers, like colorectal cancers, they spread by way of the bloodstream. So if you have one that starts in the colon and it metastasizes, where does it go next? The hepatic portal vein, and then goes to the liver, right? So if you have colorectal cancer, the next place we look at is in the liver to see if it's spread. The spleen itself destroys defective red blood cells, detects and responds to foreign substances in the bloodstream, and provide a limited reservoir for blood. Now, we're not going to talk too much detail into the spleen, right? I do want you to know, and we'll know it for the anatomy, is it's in the right upper quadrant, the left upper quadrant of your abdomen. The reason why I'm mentioning it is this, right? Usually you hear people having internal bleeding after getting into a car accident. So you're driving around, and even if you are wearing a seatbelt, when you slam on the brakes to avoid an accident, sometimes it might be too late. So your whole upper body goes forward. As it goes forward, it might hit your steering wheel. The bottom of the steering wheel can hit the top of your abdomen. Your spleen is very unprotected. There's no ribs there to protect it. So that traumatic response can rupture the spleen. And remember what the spleen does. It recycles red blood cells. So the splenic artery, when we take a look at these, we think the splenic artery looks like any other artery. In reality, it's huge, right? So I'll show you later on, like pictures of it on Anatomy and Physiology Revealed, right? It's a big artery. So you're gonna, at any one time, bring a lot of blood into the spleen. So then we can recycle 2 million red blood cells a second. So if you rupture the spleen, it makes sense you're gonna have a lot of bleeding because you have so many arteries, arterioles, and so many red blood cells there because you're recycling them, right? And it causes that internal bleeding that we always hear about. Again, I'm not going to talk too much about it. The thymus, located in the superior mediastinum, goes rapidly, and then as adults, right, it kind of becomes scar tissue and then dies off by the time you're in your early 50s to early 60s. By the time you get to be my age, it becomes almost like scar tissue, right? Actually, I'm not 50. Right, so in terms of thymus, the weird thing is this. You've heard of T cells before. What does a T stand for? Thymic cells, right? What does a B in B cell stand for? Bone marrow, right? So all of your white blood cells are produced in the bone marrow. T cells are produced in the bone marrow, then migrate to the thymus where they mature. B cells stay in the bone marrow to mature, then migrate to the lymph nodes. The weird thing is this, what happens to the T cells when the thymus disappears? right? We've always kind of asked, right? So one of the things is we know that some of the T cells might not be there as much and as long anymore, right? That's one of the reasons why elderly people are more prone to having more severe illnesses with things that we take for granted. You get a flu, you feel terrible for a couple days, and that, you know, you usually recover by 1 or 2 weeks, right? If you're elderly, yeah, I mean, it might take you out. That's why they have to do the flu shots, right? Because they might not recover it for months. All right, I am going to stop right here.